So regarding the rural hospitals, what we can say level 2, level 3.
Yes.
As boss has said, they are supported by taxes. And so the PHC is actually, the primary health care is tax funded, and it supports level 2 and level 3 hospitals. That means outpatient care. You walk in with malaria and you get treatment. If you have diarrhea, and you can walk into a level 3 hospital, get your care and go home. So this, in my opinion, is a very big conversation, that all level 2, level 3 hospitals, you are able to walk in and walk out for both in and outpatient. Now, how much money is going to be PHC? Probably we'll be able to get that from the chair, but that's a lot of money to support all this level 2, and that is the universality about this. You are able to get primary health care at Mashinani. Now, the level 4, 5, 6, on the other hand, will benefit primarily from the SHIF. Now, SHIF, you can say, probably can be considered as the mirror of NHIF. So, SHA, and I keep hearing you say SHIF Act. It's called, sorry, the Social Health Act. So the authority is the mother of these 3 children. Yeah. So the authority has given birth to ECCF, that's what we call it, the Emergency Critical Care and Chronic Disease. So the emergency part has the ambulance package, and he also has the emergency medicine package. So for hospitals like KUTRRH, we are leveraging to make sure we are ready to support the Social Health Authority with emergency services. So anybody with an accident, anybody with a heart attack, we have already set up a huge accidents and emergency, which has 16 beds. We are able to take care of all traumas to the head, to the abdomen, you know, so all those traumas we can take care of. We can take care from door to CT scan, takes us less than 10 minutes. So if you come with a motorbike accident and you get a head trauma, from door to CT scan, it's 10 minutes. I tell you, there are few hospitals in Kenya who can achieve that. All this is because we are preparing to support the ECCF, the Emergency Critical Care and Chronic Disease Fund. So how much money do we expect to be given to, say, ambulance services? We expect in the first year, up to the fourth year, there will be probably graduation of that money. But do we have ambulances? Our role will be probably to receive the patients. But as a strategic direction that this country should take is there will be money given by the Social Health Act. So the people who are ambulance providers will be able to leverage on that. And for those of us who are providing emergency medicine, we'll be able to provide access to emergency medicine, whether it is a heart attack, whether it's a stroke event, whether it is a snake bite. And then to the last about the ECCF, we're able to provide critical care. Kenyatta University Referral has 67 ICU beds. And this time it's going to be reimbursed at market rate. So whereas in the past, we used to have about 19,000 reimbursement, and our expenditure per day in any ICU is between 30 to 40,000. So eventually, now, SHA is going to reimburse critical care and at rates that are marketed. So hospitals will be able to be, and this is the genius about this entire conversation. So SHA gives you PHC, which has a huge conversation, and there's a lot of the PHC that talks about prevention. And I think this is where you really need to concentrate. Primary health care will have a lot of prevention conversations. Yes. And so from screening of the prostate, of diabetes and hypertension, you know, so screening of CA cervix, cancer of the cervix. So all of this will be happening at the primary health care fund. I think it is important for Mwananchi to be able to understand these differentiations about SHIF, ECCF, and PHC and their role.